Hi everyone. Welcome to our channel. Today, we will unveil the 6 most detrimental foods for arthritis. Additionally, we will uncover the true underlying cause of pain and inflammation in your joints and present the ultimate solution to address it. Arthritis is a prevalent medical condition characterized by joint inflammation, swelling, stiffness, and diminished range of motion. With over 100 different types of arthritis, 2 primary forms dominate: osteoarthritis and rheumatoid arthritis. Osteoarthritis, the most prevalent form, occurs when cartilage gradually deteriorates over time due to wear and tear or injury. On the other hand, rheumatoid arthritis involves an autoimmune response that triggers joint inflammation and can affect other organs in the body. Other types of arthritis include psoriatic arthritis, an autoimmune disease that affects individuals with psoriasis, a skin condition characterized by red patches with silvery scales. Gout, another painful condition, emerges from the accumulation of uric acid in the joints, particularly the big toe. Fibromyalgia, a chronic disorder, is distinguished by widespread muscle pain, fatigue, and tenderness near joints. While each type of arthritis presents its own unique symptoms and associated risk factors, they all share a common thread: inflammation plays a significant role in their development. Let's commence by discussing the first food that worsens joint pain, followed by an exploration of the true root cause of inflammation in arthritis. Number 6. Oils and trans fats. Vegetable oils, also referred to as refined seed oils, are among the chief culprits when it comes to aggravating arthritis symptoms and inflammation. Commonly used oils like corn, sunflower, safflower, and soybean oils can be found in households and restaurants. It's challenging to avoid vegetable oils since they are also present in large quantities in packaged or processed foods such as potato chips, hot dogs, white bread, fried chicken, French fries, and salty snacks. The primary reason these oils are detrimental is their high content of omega-6 fatty acids, which are prone to oxidation when exposed to heat and light. Oxidation refers to the oil being damaged by chemical reactions and turning rancid. These rancid oils significantly contribute to inflammation in your gut lining, joints, and blood vessels, thereby exacerbating chronic pain and disease. Even worse are artificial trans fats, often labeled as partially hydrogenated oils on food packaging. Vegetable shortening used in baked goods, microwave popcorn, margarine, fried fast foods, and non-dairy coffee creamers are common sources of trans fats. To reduce inflammation, it's advisable to replace vegetable oils with healthy fats like avocado oil, macadamia oil, coconut oil, grass-fed butter, and extra virgin olive oil. Before we delve into the next detrimental food for arthritis, let's examine the root cause of joint pain. While you may have been informed that inflammation is the sole culprit, the truth is more nuanced. The real underlying cause is an excess of fibrin around the joints, leading to chronic inflammation and pain. So, what is fibrin? It is an insoluble protein involved in wound healing and serves as the foundation for clots, scabs, and scars. Here's how fibrin operates. When your body experiences an injury, even a minor bump, scratch, or sudden change in temperature, it triggers a reaction. First, white blood cells are dispatched to the affected area to combat infection, resulting in inflammation and swelling. Second, fibrin is released to form a resilient, mesh-like web that seals off the site and initiates the healing process. This mesh is crucial for capturing the platelets and red blood cells required for blood clot formation. Normally, once the injury is healed, fibrin breaks down, and inflammation subsides. However, in arthritis, fibrin continues to accumulate in the blood vessels and connective tissues surrounding the joints. Excess fibrin thickens and hardens, forming scar tissue that restricts blood flow and oxygen. Consequently, the healing process slows down, causing prolonged stiffness and pain. This is precisely why pain medications become less effective over time. They overlook the root cause of the problem. Fibrin doesn't solely affect the joints. As long as there is excess fibrin in your circulatory system, it hampers the delivery of red blood cells to areas where they are most needed. Consequently, your heart has to work harder, and your blood pressure increases. Elevated levels of fibrin in the body raise the risk of heart disease and stroke. Before we reveal how to break down fibrin, let's examine other detrimental foods that contribute to fibrin accumulation and inflammation. If you find this information valuable, please like, share, and subscribe, and click on notifications to ensure you never miss a video. Moving on to number 5, let's discuss the impact of soda and sugar on arthritis. Soda, particularly due to its high refined sugar content, has been found to worsen osteoarthritis. When consumed, soda leads to rapid spikes in blood sugar and insulin levels, ultimately resulting in increased inflammation throughout the body. Moreover, sodas and other sweetened beverages that contain high fructose corn syrup contribute a significant amount of empty calories. These empty calories contribute to weight gain, which further exacerbates arthritis symptoms. To combat inflammation, it is advisable to replace sugary beverages with unsweetened tea or water. By making this simple swap, you can reduce the intake of refined sugars and provide your body with a healthier alternative. Now, let's move on to number 4, refined carbohydrates. Have you ever experienced increased joint discomfort after indulging in a substantial amount of pizza, bagels, cookies, donuts, or pasta? This is because refined carbohydrates, found in these foods, swiftly break down into sugar, causing a surge in insulin levels. Consequently, body-wide inflammation occurs, similar to the effects of soda consumption. To mitigate unwanted inflammation, it is advisable to replace white bread and pasta with healthier alternatives such as whole grain bread and sweet potatoes. However, it may be beneficial to consider skipping gluten, as it can be a potential trigger for inflammation in some individuals. Now let's discuss number 3, gluten. For individuals with celiac disease or gluten sensitivity, the consumption of gluten can elicit an innate immune response that may trigger joint pain and other related symptoms. A study published in the Oxford Journal of Rheumatology demonstrated that 41% of participants with rheumatoid arthritis experienced improvements in their symptoms while following a gluten-free diet. If you suspect that you have gluten intolerance, it is recommended to eliminate all gluten-containing foods from your diet for a period of 2 weeks. During this time, carefully observe if your joint pain worsens or improves. After the elimination period, gradually reintroduce gluten and monitor your body's response. Gluten is a protein present in wheat, barley, and rye. By paying close attention to your body's reactions, you can gain insights into whether gluten plays a role in exacerbating your joint pain. Now, let's move on to number 2, char-broiled and blackened foods. If you have arthritis, it is advisable to steer clear of high-temperature cooking methods such as broiling, frying, and grilling. These cooking techniques produce advanced glycation end products, AGEs, that can intensify inflammation and worsen joint pain. Therefore, it is recommended to avoid foods like grilled meats and fried potatoes to minimize the intake of these inflammatory compounds. And now, let's explore our number 1 contender, Nightshade Vegetables. Individuals with osteoarthritis, rheumatoid arthritis, or other joint issues such as gout may find it beneficial to eliminate nightshade vegetables like tomatoes, eggplant, potatoes, and peppers from their diets. Nightshades contain alkaloids that have the potential to contribute to the accumulation of calcium deposits in tendons, ligaments, cartilage, and joints. This accumulation can lead to inflammation and pain. Now, let's delve into how we can address the root cause of arthritis, which lies in the realm of proteolytic enzymes. Here's the key takeaway. Proteolytic enzymes possess remarkable anti-inflammatory properties and are vital for a life free from pain. These enzymes, also known as proteases, are a type of systemic enzyme that breaks down proteins into smaller, more easily digestible units that the body can utilize effectively. One of the primary functions of proteolytic enzymes is to break down excess fibrin present in the circulatory system and connective tissues, including the muscles. By doing so, these enzymes help eliminate fibrin and scar tissue, allowing for improved oxygenation and the delivery of nutrient-rich blood to the tissues. This process aids in the removal of metabolic waste that contributes to pain and inflammation. Although the body naturally produces proteolytic enzymes in the pancreas, their production significantly decreases after the age of 27. Therefore, it is important to obtain them from dietary sources or through dietary supplements. Two excellent food sources of proteolytic enzymes are pineapple and papaya. Bromelain from pineapple and papain from papaya have demonstrated effectiveness in reducing pain, swelling, and joint stiffness in individuals with arthritis. A link to a pineapple joint elixir recipe is provided below. Additionally, other foods rich in proteolytic enzymes include kiwi fruit, figs, ginger, asparagus, and fermented foods such as sauerkraut, yogurt, kefir, and miso. Beyond their role in fighting inflammation and pain, proteolytic enzymes serve other significant functions such as relieving muscle soreness, expediting wound healing, regulating blood pressure, boosting the immune system, and even combating viruses. In conclusion, if you're looking to alleviate arthritis pain, it's worth considering the inclusion of pineapple and papaya in your diet. Nevertheless, it's crucial to recognize that relying solely on food may not be enough to effectively raise your enzyme levels and provide relief from the pain. Thank you for tuning into this video. If you found the information valuable, we kindly ask you to share it with your loved ones. Stay tuned for more upcoming videos. Until next time, take care and goodbye.